Welcome back, everyone, in War Eagle. My name is Eddie Orantes, and I'm the Director of Business Operations for the Office of Alumni Affairs. And for the next 30 minutes, your host of 18 minutes and 56 seconds, the Auburn Alumni Association Speaker Series. To see all our shows, you can go to aub.ie/1856 series. We want to keep this fast moving, so all our guests will talk and present and do whatever they do for no more than 18 minutes and 56 seconds. Now, we want to hear from you, especially today. So ask questions and interact by leaving comments on our Facebook page. We'll do our best to answer them in the half hour that we have together. Today, I have the great pleasure of spending 18 minutes and 56 seconds with Dr. Fred Kam, Executive Director of the Auburn University Medical Clinic. He will discuss his role at the university, a healthier you initiative, and how students should prepare for the fall. Welcome to the show, Dr. Kam.
Well, thank you all for having me.
It's exciting to be able to speak to you, especially under the current circumstances. And before we go into the circumstances, like I do with every show, I really want to get to know my guests and learn about their Auburn story. So if you would please share with us what your Auburn story is so that our viewership gets a better sense of who you are as a person and your profession.
Sure. So real quickly, I was born in Trinidad and Tobago down in the West Indies. And I grew up there until I was 15, was sent off to high school in England. After England, went to the University of Miami, where I did my undergrad medical school residency, and then was on the faculty at the University of Miami School of Medicine before coming to Auburn. And I'm pleased to tell you that I've just started my 25th year at Auburn, leading the Auburn University Medical Clinic. I'm married to Charlene, my wife. We have 3 children. All 3 will finish with a degree from Auburn by next year, May. 2 with bachelor's and 1 with a master's. So we're happy to be here. It's been a great opportunity. We came to Auburn because of the opportunity, and what a wonderful place for us to raise our kids. At the time, we only had 2 little ones, and we've since we had Charlton while we were here. So yeah, it's been great.
What a great story. I appreciate you sharing that. Naturally, we benefit from you and your family being here. And I'm going to say this often throughout the show. Thank you. I know that there's a lot of work that you've put into establishing your career, but the value that you bring is something that all of us feel, students, faculty, as well as the community. Speaking of the value that you bring, can you also share with us a little bit about the Auburn University Medical Clinic, which you are the executive director of? What is it and how does it work and function within campus?
So when I came to Auburn, to take over, it used to be what was called Drake Student Health. And there were a lot of reasons why Auburn decided to change the process, change the model, and I came with as a big part of that change. So one of the first things we did was we changed the way that it would be supported or financed. So unlike most college and university health centers where there is a per credit or a per semester fee to support the health center, we don't do that. We're a fee-for-service operation. So we have to be able to compete with just about every other entity in town to deliver healthcare. That pretty much helped the university save more than about $2.5 million per year, which they were then able to use to resource other entities, everything from computer labs, etc., on an ongoing basis. And like I said, this is the 25th year of that process. So it's been a good opportunity. We are the on-campus health center, but most people think it's just the on-campus student health center. That is not true. We take care of students, faculty, staff, even people from the community, again, because we're a fee-for-service operation. It's actually a contractual arrangement between Auburn University and the East Alabama Healthcare Authority, so EAMC. It's been in place for a while, and so we are a division under the Healthcare Authority, and that's worked out really well. We're busy. Last year, we saw close to 45,000 visits. When I came back in '97, the clinic was doing just about 18,000. So it's been a busy process, and of course, COVID has added a new set of challenges to the whole process.
Well, and how fortunate we are that we have a infrastructure already in place to accommodate and support what COVID is bringing to us. But before we go and speak about COVID, I would like to ask the viewerships to please pose those questions. I know that there's a lot of parents, alumni parents that are sending their children here. There's possibly students. There's individuals within the community that are watching this Facebook Live. And so if you have questions for Dr. Kam, start posting those now, and we'll get to them as soon as we can. Now, about your staff, I'd like to first thank them for the tremendous work and the hours spent supporting this current COVID pandemic that we are in. Can you tell us about COVID first, and then, if you don't mind, telling us a little bit about how you've prepared and what you are doing to support students and parents through COVID?
Sure. So of course, as COVID-19, as it's called, is a disease caused by the SARS-CoV-2 virus, a virus which was really discovered and typed back in January of 2020. So this is a very, very new virus to us. We call it a novel coronavirus. It's from a coronavirus family. I will share with you, the challenge is that this virus has been throwing some really big curveballs to the medical community over the last 7 to 8 months. Just when we think we know something new, something new pops up. So it's been never in the history of medicine, never in the history of medicine have we focused this much effort and this much attention. I mean, there are over 20,000 articles published on this disease in just 8 months. That is unprecedented. So it is an unprecedented situation in a lot of ways. Now, as far as Auburn and us preparing for this process, back in I will tell you that on January 9th, so classes started at Auburn on January 8th. On January 9th, I had sent an email to our international student office and our Auburn Global program head, and basically say, I would like you please to identify all students who are coming from Wuhan, China, and the Hubei province. And that was really because I just read about this unknown situation that was happening in China. And this was in late December when I read it while I was visiting our son, an Auburn grad in Napa, California for the holidays. And simultaneously, I called in my head nurse, Lisa, and said, I would like you please to go ahead and order as many N95 masks, gowns, gloves, and hand sanitizer that we can order. And she looked at me like, why? And I said, well, I just have a bad hunch about something that's going on in China. And I think that, we should go ahead and do this. Fortunately, she did. And we had prepared for a pandemic even prior to COVID. So we already had a stockpile of PPE. So to this date, the Auburn University Medical Clinic, my team, we've never ran out of PPE and not even close to being in that situation. We've prepared, we've drilled, we've done all those things. And then around January 20th, I reached out to President Gouge. This is before any lockdowns in China or anything. And I said, look, I'm very concerned about this situation that's cropping up in China. And I had a discussion with him. And to his credit, being the leader that he is, he actually said, well, I would like you to come on February 3rd and present to the president's cabinet, which is made up of all his leaders from all facets of the university. And at that meeting, I stated, look, I don't think this is going to be a if, it's going to be a when. And this is my opinion. I think we will have to pivot to online classes. We may even have to shut the university down for a while, as much as 4 weeks. We will have to work from home. We'll have to, again, Dr. Gouge, being the leader that he is, formed immediately a task force. We started meeting and started preparing about how to do all of these things. And lo and behold, come middle of March, the first case pops up in Alabama, And before we knew it, the first case in Lee County. But we had already pivoted, and then March 16th, which was the Monday after spring break, we already had a tent set up outside the clinic. We had already put into place the mechanisms to screen people outside and take care of them as patients, those who were considered at risk. And within a week, we had the ability to start testing folks based with support from the Alabama Department of Public Health. And then we went on to offer PCR testing through commercial labs. And then we were able on June 5th to start offering the rapid test. So today, it's at this clinic, we've been able to have the ability to perform over 9,500 tests today,
Wow.
which is phenomenal. My team has risen to every challenge. I could not be any prouder of a group of people who have worked day in and day out, really emotionally taxing, physically taxing, mentally taxing, but yet they've risen to every challenge we've had. So it's been a
That's
privilege.
it's remarkable, and at the same time, it is an endeavor, a large endeavor, and it takes multiple groups to collaborate to make this possible. Let's fast forward January to present. We're 1 week away from starting classes. 30,000 potential students coming back. A lot of parents that have sent their children here. I've received a couple of questions from Facebook, and before I start reading those, and by the way, you've got fans. You got people that love you right now, Dr. Kam, and I'll share with you in a few minutes who those individuals are. But can you talk to the parents about what they can be reassured of as they're sending their children to Auburn to start their classes next week?
Okay. Well, first off, let me say that the opinions that I'm expressing are mine. It's based on my opinion, my experience, but also on science. And where science isn't available, then it's on good medical judgment. So my first statement is, we're going to have to learn to live with this virus. With or without a vaccine, we're going to be dealing with this virus for the next few years. And, for the parents, this is not just impacting you for the last few months. This is going to impact you and your sons and daughters for the next few years. Who would have known, that this virus would have been so disruptive, forced people to lose their jobs, unemployment rates gone up, all sorts of things have happened, so we need to learn to live with this virus, and no matter what we do, locally, at the university, statewide, nationally, worldwide, vulnerable people will continue to be vulnerable no matter what. That isn't going to change. Okay. And we cannot make every environment safe. We can make it safer, but we cannot make it safe, because as long as people, are congregating, interacting, not following, wearing masks or hand sanitizing or social distancing, the virus has one mission and one mission only, and that's to find someone who hasn't been infected and infect them. That's all the virus wants to do. It has no other purpose than to do that, because without infecting someone, it doesn't propagate. It can't multiply. It cannot, spread. So that's its mission. Okay, and we're in a battle against that mission, against really an invisible enemy, and
Yeah.
that's what we've been battling against. So, you know, Auburn has been planning and going through multiple efforts against really tough situations. I mean, just trying to get supplies that you need is a challenge. It's not just a challenge for Auburn; it's a challenge for everyone.
Right.
Uh, you know, I mean, up until a month and a half, you couldn't find hand sanitizer. You couldn't order some of these things. Now we have, lots of all of these uh, things available. The clinic is well positioned to handle this situation. If we were to have, do I expect little spikes and outbreaks? Absolutely. I think anybody who doesn't is an ostrich. So yes, I expect that to happen. So we're well positioned. I think for the parents, the biggest thing that you can do is constantly remind your sons and daughters to, wear their masks, sanitize their hands, and to the extent possible, keep distances from people unless it's absolutely necessary.
Thank you for sharing that and reassuring those parents. It is something that we are all very, very aware of and doing our part here locally within administration and on campus and buildings to ensure that all of the proper care is in place for those students to be safe. I'm going to share a couple of things that have come through Facebook. Frank Montes says hi, and War Eagle.
Warren.
Riley Summers says Dr. Kam is the best. This is great. Here we go. Chuck Isbell says Dr. Kam is awesome man. Thanks for having him on this show. Then there's questions, additional questions. What to do if your child tells you they're exposed to someone who tested positive for COVID? So maybe we can talk about specific scenarios. Would you mind sharing what the child can do or parent can do?
So again, it doesn't matter who it is. If you believe that you had a direct exposure to someone who has COVID, actively maybe contagious, then the first thing you want to do is not spread it yourself. So, in that situation, number one, I would begin the process of self-quarantining, or isolating as the case may be, within even your room or household. So putting on a mask, letting people know. Again, I think that trying to be more open and transparent about, hey, I think I may have been exposed, or I believe I may be coming down with early symptoms. That's important. So doing what you can immediately to begin the process of not propagating the possible spread. Then the second thing to do, would be to look at your options. What are your options for getting tested? What are your options for isolating or quarantining away from others if possible? And so at Auburn, again, we've already set up and have actively being used an isolation dorm for people who are positive, known to be positive, have the disease, and they can isolate in a dorm on campus. We have that in place and it's being used right now. And then we have another dorm for quarantining. So those are people who've been exposed but haven't yet been diagnosed or had a positive test. So they're in a state of under investigation. And so we have that dorm also available. In addition to that, there are other options. Some students who've already tested positive or have been exposed have made the decision to go home. Okay. But not everybody can jump in a car and go home.
Right.
Some are out of state, and that's not an option. So we've got, again, we thought about all of this and put that into place. So then the next thing that a person should be doing is self-monitoring, looking for signs and symptoms. But remember, this virus is very different and unique in that 40 to 80% of people who are infected with this virus can be totally asymptomatic. So when they go through a checklist of questions or they check their temperature, they are negative. And so, that makes the virus more challenging for us. And in the process, those people who may be infected and asymptomatic can spread the disease to others. So that, it's been a roller coaster ride with this virus.
Sure. It also puts into perspective why masks and washing your hands is so important because of those asymptomatic scenarios where you really don't know. And so the best thing you can do is just prepare, stay ahead of it.
We know that this is a virus that's predominantly spread through the respiratory route, where clearly respiratory droplets, more and more data may be coming that aerosolization is part of it. For the record, I don't know, I haven't read a single report yet of this virus being spread through a touch surface. Now, we're doing a great job of wiping down a lot of things.
We are.
But we have not seen any candid report where it's been documented that someone touched a surface and then got the virus from in that mechanism. But it's definitely a respiratory spread virus. Therefore, the use of face masks is crucial and critical to reduce the spread.
A question came through, Doctor, as we were speaking. Is there any risk to our health wearing masks all the time?
The answer to your question is, as of right now, the answer is really no. Now, I will tell you a general rule because I get asked this all the time. What's the best mask to wear? My general rule is the more uncomfortable it is to wear that mask and breathe, probably the better and more protective that mask is. So like, for example, in healthcare, we use N95 mask when we interact directly with patients. Great mask, but it's an uncomfortable mask and we wear it for hours and hours. So is there any health risk? They've looked at it, and the concerns were, oh, are people going to have a higher level of carbon dioxide in their blood because of wearing masks? That hasn't panned out. Okay. And there are some circumstances where wearing a mask could be a challenge for an individual. There are certain masks that can't fit a person's because of deformities, because of underlying issues. That may be the case, but those are very few and far between. And, again, the goal of wearing a mask is to reduce both you giving it to someone, especially if you're in that asymptomatic group, as well as you getting it from someone. And there's data that shows that both of those circumstances happen if you wear a mask.
With regards to masks, we'll stay on that vein. A question came through: how often should you clean and wash, especially your cloth masks?
So my rule is, you should be washing your cloth mask at least once a day, and more. That's why when we were doing the Camp War Eagle sessions, I recommended to the parents that they send their sons and daughters with at least 5 to 7 cloth masks, because I know there's no way that the average student is going to wash that mask every day. We'll be lucky if they wash that mask at least once a week. So if you send them with one for at least each day, God willing, if they do their laundry once a week, then there's a chance that that will happen. So that's the answer, at least daily.
Okay, great. Sounds like it's becoming part of the undergarment now. We're just washing it all, have one for every day of the week. I get it.
That's right.
Here's another follow-up question. Jonathan Dismuckus, I hope I pronounced that right, uh, asks, beyond the physical health of well-being of Auburn students, how is Auburn University and the Health Center addressing the danger to social, mental well-being of students due to the ongoing disruption caused by COVID? So, mental awareness. What can you tell us about that?
So if this is young Jonathan Dismukes, I hope he's doing well in medical school. So let me answer that question. Yes, the social interaction is very critical and important to a person's mental health and well-being. I feel for our incoming freshmen who've had their lives disrupted. They couldn't have a high school graduation, a prom, and all the senior trip and all the things that they would have normally enjoyed. And now they're entering into an environment under very, challenging circumstances. So it affects their mental health. We are, as humans, we love, touching and interaction and
Sure.
going back and forth. And of course, this virus has disrupted the flow of all of those processes. That's why we thought it was important at Auburn, again, as best as we can, to provide a community, an environment, safe interaction in an effort to help people, again, grow, develop, and address their mental health. So we've got, again, a number of mental health capabilities on campus. Our counseling and psychological services. They've got a couple offices available. They've got a number of counselors. But it's again, some of your best mental health improvement is relying on friends and family and support and people, around you, your roommates. So that's important. And I feel all of those are going to come to play over the next few weeks and months.
Thank you for answering that. We've got about 3 or 4 minutes left, and there's two very, very good questions that are out there. Before we go into those two questions, I do want to make a quick plug for what Auburn is doing with the A Healthier You initiative. And that is something that can be found online. I know that there's a lot of great information that addresses multiple scenarios for parents, students, and faculty. And so I want to thank you for the work that's been done to create this A Healthier You. I know that it's really helpful. Is there anything you want to share on that briefly? And before you go and answer that, I can ask one last question. Football, what's going on? Are we going to have it? Or we've got to ask it. In the last 2 or 3 minutes, if you can talk a little bit about both A Healthier You and football, please.
So I'll give you the three things, right? The two most common questions I get asked is, are we going to have football? Well, I'll tell you, if it were up to Fred Kam, and this is only Fred Kam's opinion, we would have football. We need something else to talk about other than COVID and elections. Now we need something else, and football will be something we could talk about every weekend. It'll change and give us something to talk about until the next set of games are played. So, I do hope and wish that we would have it, but it is not Fred Kam's decision. That's in the hands of the presidents of all the different conferences, and a couple have already decided that they are postponing it to the spring.
Mm.
I'm not sure what the reason in, because I can tell you the virus is going to be around in the spring. So, um, so that's number one. A healthier you. So many people have put in hundreds of hours to make a one-stop location for everything to be COVID related, to be in one place. So, if you have a question, you have a concern, you want a question answered, you want to tell us something, you want to find out something, just go to an A Healthier You. That's the place to go. Okay, as it relates to Auburn and how we're dealing with the COVID situation. And then the third question I get asked, the third one you didn't ask, but it's going to get asked, and that is there a number? Is there a trigger that's going to cause Auburn to go all back online and, stay at home and do all that? And the answer is there's not a number or a trigger. There are a lot of factors that we look at every day and multiple times a day. Everything from what's the local situation at East Alabama Medical Center, what's going on in the county and statewide. Are we having any concerns or disruptions in getting supplies such as PPE or food supplies and all the other aspects. So there are going to be a lot of different factors. What's the percentage of positive test results coming back from all the different testing centers that we have access to? We have access to information here at the clinic. We have access to testing done at EAMC. We know how many people are coming through the ER, how many are getting admitted, how many are testing positive in the ER. All those things I have daily access to. So that plus, again, consulting with Auburn senior leadership, all of those things are going to come to bear to make a decision on what's best. Okay.
Thank you so much. Pam Brownfield says, thanks for taking care of our kids as they pass through Auburn. And I cannot echo that enough. We've enjoyed the time together. We're down to the last minute, Dr. Kam. The Auburn Alumni Association appreciates the work that you've done. Thank you for joining us and sharing this 30 minutes with our live viewership. Commend you for the work that you continue to do. And I like to ask those viewers to join us next 2 weeks from now, August 27th at 11:30. We will spend 18 minutes and 56 seconds with Dr. Martin O'Neill and Hans van der
Reyden. Hans van der Reyden.
Discussing the Tony Bahrain Culinary Science Center. Don't miss it. Until next time, doctor, stay safe and War Eagle.
War Eagle.